Great, I think it's time to start. Good day, wherever you are. Good evening if you're in India. I'm Ingrid Srinath, and I'm Director of the Center for Social Impact and Philanthropy at Ashoka University. Thank you all for joining us this evening. I'm going to start by asking you a question just so that we get a sense of who's in the room. So Gautam, if you could post the poll question, please. Do tell us which organization or what kind of organization you represent. Can you all see the poll question? Thank you. Gautam, are you going to show us the results? Wow, so 61% are nonprofits, but then we have quite a range of social businesses, foundations, ecosystem organizations, even to for-profit businesses, some from academic institutions, and one from government. Welcome all. Thank you for joining us. I think it's kind of almost become, you know, a truism to say that every section of society in India has responded to this pandemic and its knock-on effects. I mean, whether you're business or philanthropy or journalists or just citizens across the length and breadth of this country. I think it's only now, however, in the last couple of weeks that there's been growing recognition of the fact that it is the nonprofit sector that has shouldered the bulk of the responsibility, as responses from public systems in particular were slow, partial, and uncoordinated. The research that we will be sharing with you today and others like it have shown that literally the vast majority of nonprofits across the country have responded, whether or not disaster relief has been part of their mission up to now. Many have dipped into their reserves and put at risk their staff and their regular programs to respond, even when donor support was either absent or delayed. And for those communities that are far removed from the spotlight or those activities that donors are not inclined to support, it's really been nonprofits entirely that have come to their assistance. What we've been trying to do via this research is answer the questions: what has the effect been on these nonprofit organizations? How have they coped? How are they coping? What does the next 6 to 12 months look like for them in a scenario where the bulk of philanthropic funds have either been directed to the PM CARES Fund, where it will slowly find its way to very big centralized initiatives rather than to grassroots organizations, or to direct relief in terms of just ensuring that frontline health workers are equipped with PPE, or that there's tests available and so on. The crisis is far from over, but even as we now start to focus on medium and long-term needs, it's clear that we need to also seize the opportunities for change that the crisis has opened up for nonprofits, for philanthropy, but in the broader public policy space. We have the opportunity, it seems, to reimagine systems of public health, public housing, urban development, education, labor rights, and the whole domain of social protection. As Darren Walker, I think, of the Ford Foundation put it, in a situation where we find ourselves with overwhelming need paired with existential threat if you're a nonprofit. Countries from Canada and the UK to even China and Russia have provided tax incentives, relief packages to civil society to enable them to keep their staff payrolls going and their establishment expenses going. Because there is a realization that the need for these services of these organizations has never been greater. And also a recognition of the fact that any shutdown or downsizing in civil society will put at risk development outcomes overall and the lives of millions at a most inopportune time. So the intent really of this research and for today's webinar is to trigger many conversations within NGOs to start with, between NGOs and their donors, within philanthropies, and particularly among those who seek to shape policy through this pandemic and beyond. We'll start with my colleague Lina, who is Interim Research Director at the Center for Social Impact and Philanthropy, who will share with you the key findings of the study we just did. We're also fortunate to have with us a great panel to help bring those findings to life, if you will, through their lived experiences and to share their learnings for the benefit of all of us. And then after we've had that panel discussion, we'll take questions from you. Please enter your questions in the Q&A box throughout the webinar. My colleagues will be keeping track of them, and we'll try and answer as many as possible towards the end. Without further ado, Lina.
Thank you very much, Ingrid, and hello, everyone. Let me see if I can pull up the sorry, I'm just trying to pull up the PowerPoint. One minute. Okay, so before we start, I wanted to just say a big thank you to the team. This has really been a team effort at CSIP, and I want to particularly mention Divya Chopra, who's been leading this research over the past 3 months. All right, I hope that's now fully shared with everyone. So like Ingrid mentioned, the COVID pandemic, which started out as a health crisis, very quickly turned into a triple crisis, where we've had health, but we've also had healthcare and scrambling for to strengthen the healthcare system whilst we were all in lockdown. But at the same time, we ended up with an economic crisis and a social crisis all out of this lockdown. What we wanted to do at CSIP was really to understand what is the work that nonprofits have been doing to mitigate the triple crisis, and what has the impact of this triple crisis been on them, both in terms of operations and financially, and what can we really do to strengthen and enable the nonprofit space in India. So we had 3 broad questions that we wanted to ask. We wanted to know, like I said, what's been the impact of COVID-19 on the operational and financial status of the NPOs? What are the coping mechanisms that the NPOs have been using, and that could be other NPO, nonprofit organizations? And what are ways that funders and other stakeholders in the philanthropy ecosystem in India can best support nonprofits today, in the short term, medium term, and in the long term in terms of building resilience? So that's what we set out to find answers for. To do so, we undertook a rapid response research project, which essentially means that we, in a matter of a couple of months, did the background work, created a questionnaire, interviewed about 50 leaders from different nonprofit organizations across India, and then wrote this report. So it's been a very quick turnaround of this report. Which is all why we call it a snapshot report, is to give you sort of a ground level, a quick insight on what's happening on the ground. So when we're talking about these 50 nonprofits that we spoke to, who are they? So we really try to capture a range of nonprofits across geographic regions in India, working across different sectors, working from all the way down from the grassroots community space all the way up to policy level. we've got about a quarter that are Section 8 companies, and the rest are trusts and societies. And then a vast range in sizes from both in terms of budgets and employees. So, so really trying to sort of capture a snapshot of India's very large nonprofit sector. And I think what we wanted to also, what we think was interesting, what came out of the research was the range of funding that these nonprofits have. So all the nonprofits have a sort of a portfolio approach to funders. They all have a range of sources of funding. But we thought it was important to pull this slide up because we'll speak about the difference in fund approaches of funders later on in the slides. So, like I said, all of them had a mixed range of funders, but 50% were particularly reliant on CSR funding. About a third were primarily reliant on international funders and donors, and then about 20% were then relying primarily on Indian philanthropic funding. And so the last thing I wanted to note here in terms of the methodology before we get into the results is that in order to do the research very quickly and be able to do so in a very challenging environment that the pandemic has been, we relied on CSIP's in-house networks and databases. But you know, even so, we think that so even though we use purposive sampling, we still have really achieved our aim of getting a sort of representative overview of the key issues on the ground and sort of thoughts from the nonprofits on what they need from the ecosystem as well as what their main concerns are. All right, so so what are those critical insights then that we found? So firstly, about 3/4 of the nonprofits that we interviewed were currently engaged in pandemic relief work. And so this is about a month and a half ago that we interviewed them. The relief work was their main work at the moment. And this relief work varied across a whole range of segments, like as you can see here, anything from nursing camps helping migrants that were returning to the village, to working with the ultra poor in urban areas, working to support people in mental health issues, and working with victims of domestic violence, as well as general more awareness and sensitization of communities. So a very, very varied range of work. The second insight we had was that the COVID-19 crisis has had a significant impact on the operations of nonprofits of all sizes and across India, and in many different ways. So, for example, of course, the vast majority of the nonprofits have suspended regular programs. Linked to this is a really serious concern now that this will have significant societal implications in the medium to long term in India, as you know, regular programs dealing with marginal and vulnerable communities have been put on hold, and it's unclear when they can start again. The third is that there's been a clear change in working remotely. So, so a lot of organizations suddenly had to figure out how to work remotely, and what could they do whilst working remotely when they could no longer engage with communities face to face. So instead they switched to a lot of research, pending admin, updating websites, social media, etc. But really, again, direct interaction with communities took a back foot, other than relief work, of course. And related to this, of course, was that the response very much varied based on whether nonprofits had already jumped on the digital revolution bandwagon or not. So those that had good those that had digitalized were a lot more comfortable working during lockdown than those that had not. And a lot of nonprofits especially expressed the fact that they had perhaps previously considered digitalizing but hadn't done so. And the lockdown really brought into sharp focus the need to digitalize services and operations. Another point that came up frequently was the hesitance and the difficulty in communicating with funders, figuring out how to communicate with funders during the crisis, both about current needs, but also about future needs, and finding out what expectations were from funders and what the nonprofits could expect from the funders. There's also been a really a significant concern around long-term sustainability of operations, which of course is linked to the difficulty in funders, as well as the uncertainty in terms of long-term funding. So the majority of organizations are really unclear on how they would be able to sustain themselves long-term. Whilst about 20% of the organizations so far had already started looking at ways to re-strategize, rework programs, thinking about how best to recover from the crisis and how best to work with vulnerable and marginal communities during and after the crisis. A vast majority of organizations were still in a sort of wait and watch. They were aware that they probably needed to strategize, and they had started to think about how to rework programs, but they hadn't actively started doing so yet. And so to summarize, so the top 3 concerns overall that we got were skewed funding that primarily went to relief work as opposed to other kinds of needs at the moment, as opposed to regular programs, for example. Secondly, the lack of preparedness to switch quickly to digital operations for nonprofits, and the worry that long-term social indicators and societal problems will increase because of the inability to continue to run the regular programs as hoped for. Right. So the third impact of the pandemic has been the reduction in available finance for nonprofits. Across the board, nonprofits were really worried about the financial status and the availability of finance going forward. About 16% was said that they had funding for over a year. However, the vast majority have funding for less than a year. 30% even have funding to cover fixed costs only for the next 6 months. And we're really worried about how to, what the impact would have and the kind of cuts they would have to make to their organizations and their programs to sustain themselves. Currently, however, again, coupled with the lack of conversation with funders, there was also a wait and watch, because a lot of nonprofits said that this is the start of the financial year and they wanted to wait a little longer to see what the implications would be. Now, I mentioned at the start that while all nonprofits had a range of funding, there was some were more reliant on CSR funding than others, some were more reliant on international funding, and some were more reliant on Indian funders. So by Indian funders, we mean Indian philanthropic foundations and family funds. Now, the reason this matters is because the concerns seem to vary depending on who you were primarily relying on. So those that were primarily relying on CSR were particularly worried about CSR funding drying up. So a lot of the CSR funds have been diverted to both relief work as well as large relief funds in particular. And that, coupled with the fact that with future profits likely to reduce, there's probably going to be less CSR funding available for the nonprofits sector going forward, meant that the non-profits that were particularly reliant on CSR, which was about 50% of our sample, were really, really worried about how to move forward. They were also the ones that struggled the most to connect with funders and communicate with funders clearly on what the expectations were from the funders and what they could expect in return from the funders. On the other hand, the non-profits that rely particularly on international funding highlighted that the international funders had been quite agile and flexible with their funding. They'd also been very proactive in reaching out to non-profits, which the non-profits really appreciated. Lastly, the Indian funders it was highlighted that a lot of them had their commitment to funding was obviously continued, and they were very passionate and have a good knowledge of what's happening on the ground. However, there were worries around the delays in decision and the sort of bureaucratic time takes for funding to be dispersed. All right, so lastly, there's a few, so the organizations, about the 75% of the organizations that rely on, about the 75% of organizations that were engaged in relief work were asked what their main concerns were around finance and relief work. And they pointed out that even those that had received funding for relief work, and not all of them had, struggled to cover their operational costs through their funding, even the operational costs that related to relief work. They also said that they struggled to cover overhead costs with funding from relief work, and because the funding was very much programmatic in nature, and that there was a fairly significant gap between the agreement to fund and the disbursement of fund, which meant that non-profits had to undertake the work without having the funding available to them. There were also some concerns around compliance with funds at a time of crisis, and how it was difficult to, for example, identify beneficiaries in a way that complied with the needs of the funders. So those were our main insights from the report. What follows now are not so much recommendations as sort of some key learnings, like good practices from nonprofits and some implications for funders. Now, the good practices for nonprofits were crowdsourced from nonprofits, so these are not coming from the ecosystem to nonprofits, these were crowdsourced from other nonprofits. And what people are saying is it's time to prepare for a post-pandemic world, to re-strategize, to rethink and reconsider, both in terms of operations and in terms of budget. There's a need to communicate much clearer and better with funders, both in terms of what current needs are, as well as what the future needs will be, and the implications of not funding regular programs. There's a need to use social media increasingly, and we have some really great examples of organizations that have been able to reach a really large audience by using social media actively, as well as engaging or being more visible to funders. There's also a need to diversify funding away from being primarily reliant on one source of funding. For example, those that were particularly reliant on CSR funding felt that they needed to find other sources of funding that is, same goes with those that are reliant on international funding, and we're worried that international funds will reduce as the pandemic continues on. We talked about the need to digitalize, and that came up as a good practice to technology. And lastly to strengthen the networks of the nonprofit sector to ensure that nonprofits work in partnerships and have a strong and coherent voice. Now, what are the implications for funders and the broader philanthropy ecosystem in India based on this? So the first is, of course, encourage your partner and nonprofits to speak freely and to engage with them in terms of their needs and what implications are for the future. Be flexible in terms of timelines and commitments. and adjust expectations for current funding. Embrace flexible funding for nonprofits. Consider how best the current funding can actually be used in times of recovery and in terms of building resilience for the long term. Strengthen nonprofit organizations' capacity to raise resources, to raise funding themselves. This is something that rarely is funded to date, but is likely to be an urgent need going forward. In terms of funding, create a collaborative emergency corpus and a collaborative philanthropy corpus that can be used in times of need, and that can perhaps very quickly disperse funding to help the nonprofit sector. We think there is a need to invest in digital capacity and infrastructure across nonprofits, just like there's a need to invest in upskilling fundraising capabilities. There's a need for digital capacity to be upskilled, and provide better non-programmatic core institutional funding for nonprofits, especially now when there is a need to re-strategize and rework programs and organizations. Increase the focus on and attention to livelihood creation and reskilling, and this is especially when we're considering the large migration that has happened across the country. The last two are to strengthen non-profit networks, again, and enable nonprofits to have a strong, coherent voice to speak with, and the support ecosystem really has a role to play here to make that happen. And then lastly, continue to support regular programs, because without the regular programs, there are going to be significant implications for the longer term. Thank you.
Thank you, Lina. Gautam, will you bring us all back and ask perhaps the second poll question? Thank you to all of you who've been sending your questions in the Q&A box. Never mind. Gautam, can you restart my video, please? I think you have control of it. Thank you. While we wait for the poll question issue to get sorted out, I'm going to turn to Pritha. Pritha Venkatachalam is partner with the Bridgespan group here in Mumbai. And Pritha, you conducted a survey of your own of nonprofits quite recently, and also issued a memo with guidelines or recommendations for funders. To what extent are you seeing these findings from the ones that Lina just shared, echoing with the ones that you found in your study, or are there any significant differences?
Thanks, Ingrid. It's heartening to see so many participants here and on the Facebook Live page. I thought, at least speaking for myself, I thought we were all becoming Zombies by the end of this lockdown, but I think certain topics like this still obviously generate a lot of rightfully so passionate interest, since it hits at our very existential question of India moving towards the SDGs. So to answer your question, Ingrid, yes, we had two big sources of input. One at the start of the lockdown in early April, where along with ATECF and other partners, the COVID Collaborative, did a webinar in over 2 days in early April with about 500 to 550 NGOs attending. And there, based on a quick, rapid survey, we heard some similar existential issues, and hardly about 13% of those 500 plus nonprofits in early April said that they can see a financial runway of beyond a year. And about 54 to 55% of the participating nonprofits said they were already beginning to change their programmatic focus drastically. towards, of course, the COVID relief, basic livelihood support, etc. And then subsequently, from end of April to May, we did this rapid assessment of the funder response, and also just eyeballing some of the questions that are coming up here. Many of the funders have very swiftly pivoted towards supporting the COVID response and also enabling preparedness where the COVID pandemic has not yet hit to such gigantic promotions. But of course, that has come at the cost of not just other sectors, but also, frankly, the non-COVID health sector, so to speak. So, for example, if somebody is suffering, unfortunately, from tuberculosis, which unfortunately takes far more people's lives today in India per hour than COVID is, or mental health, which is swept under the carpet pandemic of its own nature in our country context, or indeed a lot of others that need timely medical supplies. I think all of those, including immunization, have been compromised or put back, given the country, right from the Prime Minister's office down to all of us, have needed to turn to the pandemic. So I think that the first 1 month of repurposing was quite expected, probably. And what was the silver lining was the swiftness and collaboration that was shown by all of the participants here and many others in responding to the crisis. I will not rehash the messages that your study rightly showed, but maybe I'll just focus on 5 points that are more looking forward. And I think the first thing we're hearing time and again is need to re-baseline community and population needs post-COVID. And that's not just in healthcare, but across sectors. So for example, how do you get children back into schools? India had moved away from enrollment being an issue to learning outcomes. But now with people moving so much across states, being dislocated, relocated, children being pushed out of schools because of not having digital medium, or worse off, not even having basic sustenance, how do you get them back into a learning mode? Or for example, NGOs that are working in nutrition security have now actually regressed, so to speak, quote unquote, to first cater to food security, let alone nutrition. So I think irrespective of the sector that each of us is working in, one needs to really re-baseline as we look at recovery and resilience. And of course, not everything can be catered to. There are scarce resources, and even that are even more scarce now, given CSR impact, tight fiscal situation, and funders already opening up their coffers quite generously for the COVID response. So I think, harsh as it sounds, all of us, including, some of us who are working higher up in the value chain, not on the ground in the front line, are having to do scenario planning and very sharply prioritize what are non-negotiables for the social sector, and maybe pushing out things that are important but not urgent. And that's itself a very tough humanitarian call, but I think it's critical. And I would call specifically out that vulnerable and marginalized needs should not be deprioritized. I think we're seeing the wave of racial injustice protests across the globe, starting in the US. And in India, whether it's religious minority, caste, gender, we heard CMIE stark reports that women's participation in the labor force is at its absolute low in India since the history of, since we got independence. So, a lot of these statistics are things that are glaring in our face and hopefully will not be ignored as nonprofits and funders prioritize. The second one I would call out for is what we at Bridgespan call pay what it takes, or what you all call core funding, flexible funding, institutional funding. And in our survey of several NGOs and funders, we actually heard that the cost of core operations beyond programs have gone up, because actually people have to provide for safety of the frontline workers, whether it's PPEs, washable masks, or just morale and motivation of their staff, given many of them are themselves in the vulnerable bracket of 60 plus years. I didn't realize so starkly that a lot of healthcare workers in India are actually 60 plus, because post-retirement, they have opted to become ASHA workers or Anganwadi workers. So they are in fact putting their own personal and family lives at risk. So given the cost of operations on multiple fronts have gone up, can nonprofits now really be true to what is their true cost of operations? Whether it's digital technology now, more stringent financial management, need for fundraising, and go to funders with their core costs. And I think scenario planning there is critical again. The third area is, I know you spoke about collaborations, and we saw that consistently that, although we published a 6 to 7 month study on collaboratives in February this year, we found that the action since March to now is probably as much as the collaborative action that the social sector saw over the last 5 to 8 years. And these are massive collaborations. So, for example, the COVID Action Collaborative in Health and Livelihoods is now reaching 15 states and about 2.1 million stakeholders. Similarly, the National Coalition of CSOs for Rural Work, and so on and so forth, many examples. But I think the other pulse that is less talked about is potential consolidation. So some of the work we did 2 years ago on nonprofits with, again, 500 plus nonprofits using the GuideStar database showed that 70% of that database that we worked with, which was about 500 in total, had an annual budget of less than 1 crore. And only about 6% of those nonprofits had annual budget of over 10 crores. So one can imagine the skew, and I would really think hard about, do we need consolidation in the sector, much as that word is much more prevalent in jargons like mergers, acquisitions, or consolidation, or such theorized frameworks in the for-profit world, that maybe that reality is critical now in the social sector in a more humane way as well. Last and finally, I think what we are hearing from nonprofits is, now is not the time to go to 5 or 10 or double-digit new funders, because everybody is stretched so thin, and most people don't even have the bandwidth to engage on new issues. So maybe identify 2 or 3 trusted funders who you can be vulnerable to, and actually be open to say that, you all as nonprofits also need to embrace risk. And, the whole monitoring and evaluation framework, while critical, will need a lot more headroom now, given everybody is operating in uncharted territories. So I think there it is important to, again, be sharply focused on who are those couple of funders that you can actually go to, as opposed to spreading your human and financial resources thin. And lastly, to the many funders who have dialed in, I know it's a minority of this audience, but we all saw Ford Foundation really being brave, not just in their call for social justice and equity and inclusion, but also going in, given their size globally, for a $1 billion intent to offer social bonds to effectively front load a debt obligation to be able to support the higher need of NGOs. And of course, each funder has their own constraints and possible endowments. But I think there is a request here to be more unconventional in funding. So I would end on that note, both for funders and nonprofits. Thank you.
Thank you, Pritha. I'm going to turn now to Anshu. Anshu Gupta practically needs no introduction. He's founder of Goonj, and among many recognitions is also the winner of the Magsaysay Award. Anshu, can you speak to us about how Goonj has adapted to this crisis? Because though you are a disaster relief organization, or you do work in disaster relief, I don't think you've ever had to deal with anything on this scale. This is not one coastal area or one landslide prone area or something. It's the whole country. And what are you learning? What most want donors to learn from this crisis?
Cool. So very nice that you guys are doing this study. It's a very important study, and I think the findings are also very important. We were also part of it, and I know it's very nicely framed. So to be honest, very complicated because normally in one geography it happens and the entire world tries to help that geography. And this is your next door. This is in your own house, home, right? It starts from your mate to the remotest possible tribal belt. So something which we have been boasting about ourselves, that we have created grid, we have laid pipelines in 25 states of India, relationship with, and then the collaboration with hundreds of partner grassroots organizations. Well, that's what we have built up in the last 2 decades of our work. To be honest, it was an asset, and to some extent it was a liability also to us, because then, so liability not in the wrong sense, but how do you really how do you really cope up with it, and how do you really reach out to such large audience? Because if you're working with 400 partner grassroots organizations, 300 grassroots partner organizations, in any case in the peacetime, how can you not respond and work with them? So to be honest, we took about 3-4 days to completely change the way we operate. We are known for our hub and spoke model, otherwise in all the disasters, but we decentralized the complete structure. We reached out to the smallest possible grocery shop, to the smallest possible vegetable vendors. I think we've done more than 1 lakh kgs of vegetables itself from the villages right now, right? And then we tied up with these people. We changed our format. We literally changed all our reporting mechanism. We converted our MOUs to 1-pager within 3-4 days, and then started working with the people. And one very important part, we are a hardcore logistics organization, right? So when you bring half a kg of maybe potato or mango, in your home right now, you wash it for half an hour and then consume it. And here we are, with all the restrictions, we have to open our offices. There is limitation of people. We are not equipped with that. There is huge amount of pressure from the people who are giving you money. And there is huge amount of pressure from the community. And there is huge amount of communication of your own, because you really, really want to do something big and something very, very widespread. I think, and in those scenario, opening offices, working with the logistics, roads are blocked, police is there with the lathis in most of the areas. There are no extra benefits which are given to the social sector. I mean, getting a pass might be easy, but not that easy for people. Public transport is closed, so your people cannot come. The people who need to do the sorting, packing and all. So it's been a complicated journey, but I think one of the things which happened in our case is that we have always believed a lot in the local wisdom and local partnerships. I mean, that's the asset of Gunj. That worked very well, number one. Number two, our hardcore job is logistics and dealing around material. And third, I think immediately we said that we have to change every single system on which we are working. You'll not believe the first meeting which we did, the Zoom meeting, because we closed down on 17th March, because we are very vulnerable. We are a very high sensitive public touch organization, right? So one of the first meeting happened, we actually reviewed every single format and process at what are we doing and what we need to change. And in the initial first week of that particular thought process really helped us a lot in coping up with this particular disaster. Right. And response in terms of money has been okay, but we all know that this sector actually needed, especially for this disaster, much more money, because every single space is disaster now, in this disaster. But if I compare it with earlier disaster, what we used to get in one single disaster, if you get that amount of money for the entire pan-India disaster, you can understand how it is operating. The other important part, I think the funder community, the people who are sitting with money, corporates and many more of them, I think somewhere one thing which they all need to change is certainly the lenses and also the arrogance. I think I'm very upfront in this, that some people really did a wonderful job, and they respected the social sector a lot. So tomorrow we all will talk about how much money corporates gave, how much money came in the sector, but we will never ever talk about the nuisance which are created. I mean, how can you demand a TikTok video in this particular scenario? How can you demand the signature of the so-called beneficiary in this particular scenario? How can a corporate or an institution decide whether the haldi will go or the jeera will go in the food kit? And I can tell you that, some people really did a wonderful job. I mean, we have also got a lot of money which is absolutely free, which is absolutely that, you decide and then you decide. And there are some people who have been forcing you to give a weekly report with 2 logos and few pictures. How does it operate? Are we really mindful about it, that these people, as Pritha also said, no one on this earth knows about this disaster. Even the best possible doctors do not know how to handle it. Fine. Politicians do not know. Bureaucrats do not know. Many of them are risking life. And the social sector has actually proved in this particular disaster that how big how big risk taker they are, and how what kind of empathy and emotions they run through. So I felt a lot of pressure. I mean, to one corporate, I actually had to finish up the relationship by saying that we are not your grocery shops, right? We are not buying grocery for you and supplying it to the people. And the last point, Ingrid, for before any other question, is that this whole thing about short-sightedness and all that, and I'm talking about the literal geographical meaning of it now. I think people have been very short-sighted. The issues are not just in Bangalore, Delhi, Bombay, right? If you are talking about migrant communities, after a few days, migrant people started walking. How many of us are really talking about the Indian villages which has been the destination of the migrant communities? So some people, some corporates, some funders have been very, very sensitive about it. That's really good to know. Individuals have been very sensitive about it. When they gave money, most of the individual money came without any tag. That's the most important part. But some people have created much, much more nuisance in this particular disaster without understanding that this disaster is completely different, and all of us are trying to innovate or try to cope up and find out new ways of doing it. I'll stop here.
Thanks, Anshu. We count on you to tell us the truth. Moving to Renuka. Renuka Gupta is CEO of the Pardada Pardadi Education Society, which works with girls in Bulandshahr district in Uttar Pradesh. Renuka, how has this crisis affected your organization? How have you responded to it? And what is the message you want to send to the larger nonprofit community and to donors? You need to unmute yourself.
Okay.
Yes, now we can hear you.
So this is a very, I will pick up from where Anshu left, that people are, because people can see the reality where they stay. And our reference to context is Delhi, Mumbai, Bangalore, or maybe B-class cities. But the reality is in the villages these days. And the reality is of power versus non-power, I say, because we all are talking about digitization. How can you digitize a world where there's no electricity? How can you digitize a world where there is no basic cell phone to digitize? So the whole scenario has changed. Like, we all got we ran a school also for 1,600 girls. So we said, okay, let us start thinking about how do we reach out to them, not for education, but for the basic security, because this was a time that most of the girls would have dropped out. This was a time when, even despite of us tapping each and every girl in the 120 villages, we still had reports of 5 child marriages, which we thankfully stopped. But those are the realities. It means that you're not only working on innovations, but you're going back to the roots and looking at those roots. We all have seen the abuse against women has been on rise. We have all seen hunger and poverty to the worst form that anybody can think of. So when you're at the grassroots and you're working on these kind of issues, it is not just about re-strategizing. It is about, like, how the question about what Anshu also just mentioned, the question about how do I send my colleague in a situation where I know that there's a huge like, there can be a chance of the person getting health hazard, but you have to do it. So those were the questions that we were grappling with. The questions that we were grappling with were like, how do you reach out to the most vulnerable? Because sometimes I feel very sad when we say, okay, we will give ration kit to this person because he or she is poor. But who has given us a right in this kind of a situation to define who's poor and who's not? So vulnerability also became an issue. How do you define that? And with limited resources and being the only NGO in the area, and where unfortunately government also expects that you give them rations instead of government coming up and supporting. So these are the real scenarios at the grassroots level. And of course, you have to re-strategize, you have to rethink, you have to innovate. But one thing that we were very conscious of doing was like, how do you retain dignity of the human being? Because we are working with farming community, which brings food to table of everybody. And today, unfortunately, because of short-sightedness of all of us, we converted those people into asking for food, which is so sad. And unfortunately, everybody is putting pictures of distributing food and ration. So that was one question that we always had to be working with very sensitively. Also, like changing the strategies of like we work on production center, we give jobs to the women, but now how do you work with these women and make face masks? How do you reach out to them? Because it's lockdown, you also have to create market, you have to also give them regular work and job. So there were a lot of questions, but I feel that there was a huge learning also. I also feel that emergence of new leadership you could see in the organization, which is such a positive thing. Like people came forward with kind of ideas and spirit of service which I could have otherwise in the regular scenario never imagined. And as Anshu also just said, individuals gave money without asking any questions. But in our case, even the funders gave us money and said that you can use it the way you want because we trust you. So there, I feel in terms of trust building, there has to be trust between the community that you work with, and also the funders are also a community. And we as a organizations have a great role there to sensitize them about the needs now. So that is one observation I have. Also, I also want to talk about a little bit about funders' role. I feel that they need to work on long-term partnerships. They need to get out of their comfort zones because even today, sadly, whenever you go to any funder, this, oh, you don't fall under the 16 kilometers radius. And I feel, come on, guys, I also know the CSR bill. Where did the 16 kilometers come from? The need is in the villages. The need is in the places where nobody is going. And you're still talking about your 16 kilometers? Come on, wake up. So we have to shake up the funders to say, okay, get out of your comfort zones and let us talk together and strategize together. That is what is needed. And we have to be careful about what do we mean by digitization. How much is the preparedness of NGOs to take up this digitization? We should not be just taking up or having a buzzing word just because we feel that's a need of the hour. And I also feel that one fear I'm feeling, very strong fear I'm having, is that we are losing the personal connect with the community. We should not become a bhopu jisko lekar ke you just start messaging the community. That personal connect or with that woman who can say, okay, my husband was drunk and abusive last night and he really misbehaved with me, has to be kept. And that cannot happen just by digitization. So I can go on and on these kind of issues, but I know the time is short, so I will stop here, and any questions I can take on.
Thank you, Renuka. That's a fantastic grassroots perspective. Amit, I'm going to turn to you. As a philanthropist who's been very, very hands-on engaged with this crisis, what are the key lessons that you've learned? And how do you think donors need to change in light of what this crisis is teaching us?
Thank you, Ingrid. It's a little intimidating following such a wonderful set of speakers. I'll make a few points. I think, first of all, the crisis has truly been intimidating and humbling experience. Fighting an enemy who you simply can't see, with parameters that truly change on a daily basis, with variables that are extremely limiting. Everything that you potentially would have as a tool virtually just simply doesn't exist. You can't even step out of your house in many cases, and the only people, as Anshu rightly pointed out, who are willing to set up the fight on your behalf are truly brave souls. This has been a truly humbling experience for all of us who've been supporting organizations. And I think therein lie many of my observations on what some of the learnings have been. Just looking at some of the NGOs that we've been privileged to support in this crisis. I would say that, when the rubber has really hit the road, you realize that many of us would get into excruciating data analysis, analytical frameworks. With no disrespect to Pritha, we'd hired a lot of consultants and try to add a lot of value to our own portfolio, etc. But you realize that first and foremost, what really matters in crisis and when it comes down to saving humanity is a few very simple things: purpose over everything else. The organizations that have truly delivered are the ones which had leaders and volunteers with an exceptional sense of purpose. They were the ones who had a great connect with their communities. And that's, by the way, even true about healthcare workers. And many hospitals have unfortunately seen lack of attendance, but it's truly the doctors and nurses who've had deep sense of service, who've showed up every day and worn PPE suits in excruciating heat, who had a real sense of purpose and connect, and save lives. And that's what that teaches you as well. But when it comes down to NGOs, and I think if it wasn't for civil society and these NGOs, the calamity that we would have faced, we would have not been able to feed, tens of millions of people. We wouldn't have been able to get migrants home on time. And truly, it's that sense of purpose and connect, which has really wowed me and made me at least be able to sleep some of the nights when you really wondered what was happening to society around us. And so that is something that has been a big learning. And I think we need to really reflect very hard as society on how do we preserve that? How do we deepen that? The third thing is really nimbleness. I think the organizations that have really done an exceptional job, you realize are the ones who've been able to repurpose themselves in many cases, who've been able to adapt very quickly to the crisis, and of course they will face a lot of changes. They'll find themselves with cut budgets, and they'll have to again post the crisis see how they will have to adapt. But even during the crisis, I mean, I've worked with so many organizations who were doing education and mental health and livelihoods, but started doing all other kind of things to meet what was the need of the hour at that point of time. And they all basically fulfilled, a need of society at that point of time. It was truly amazing. Many of them used tools which were available. They went and reached the donor base. They went and just did remarkable things. But I think there were many who weren't able to. And so the nimbleness of the ones who were able to repurpose and how they repurpose, I think there were lots of lessons in that. And I can tell you that many corporates weren't that nimble and faced a lot of challenges. And so I think there was a lot to learn in that. The fourth thing that amazed me, and again, challenged the notion that I've always had about organizations, both in the corporate world and the not-for-profit spaces. I've always thought that size matters a lot, but I was actually amazed. Lots of smaller organizations did a truly remarkable job. Small, mid-sized organizations, which are much more, individual-led. You saw them really lead from the front. And actually they were facilitated by the digital medium. They were able to reach very wide audiences, and you were able to directly as individuals, because a lot of corporates weren't helping society as well as they could, because I think their funds got blocked up by other sources, but individuals actually opened up their purses a lot more, and they were able to help these people. And so you saw small organizations do a remarkable job, and therefore I thought that was another very interesting learning. And so in general, I would say that these were some of the things that stood out, to me. Anshu made a number of very interesting points. I think there was a lot of learning for philanthropists as well, which I think people need to reach out to think and including the point that Renuka ji made, which is we went out and did an analysis on our portfolio, and we realized that about 25% of our portfolio is in the ICU, which is that they have less than 1 year of funding at this point of time. In fact, less than 6 to 8 months of funding. And that's not just a poor reflection on the organizations, a poor reflection on donors as well. And I think organizations, the entire civil society needs to think very hard about how they're going to make the entire not-for-profit sector more sustainable. Because if the sector goes down, I think society goes down. And I think that's a very important point that I think all of us need to think about. And finally, I'd like to, end with a point that Anshu made. Look, the problems that have happened in our society at this point of time are not accidental. All these COVID-related issues are essentially arising out of many, many decades of neglect. We could very well have avoided these problems, whether they are in urban cities or they are in our rural areas. In many cases, civil society was pointing to these problems through advocacy. And, I know some of our portfolio organizations have been talking about these issues. In many cases, even governments have been, talking about some of these through their programs. And it's high time we focus on, addressing some of these through prevention, because we now realize that if we don't focus on prevention, one problem can set us back potentially by 5 to 10 years and push tens of millions of people back into poverty. And I think the big issue, therefore, for civil society arising out of this, I think the two big issues, one is going to be how do we really strengthen civil society and make it more sustainable. But I think the second big issue for civil society arising out of all of this is how do we really take a more strategic issue toward a strategic perspective towards all issues which are more sticky. How do we focus on prevention in a more systematic way? With that, I'd like to hand back to you, Ingrid. But I think lots of learnings for me, given the work that we do, lots of notions, challenges as well.
Just one more aspect, Amit. What's been your experience in terms of learning about how to collaborate with government?
Yeah, thanks for asking that question. By the way, I made this point on another webinar as well. I do realize and I'm sorry I didn't make that point earlier. If we would not have collaborated on many of the issues, I think we would have made no progress. We realized that this was such a massive problem that you needed to collaborate. In fact, in many of the initiatives, we have collaborated with multiple entities within the not-for-profit space as well. For example, we have worked very extensively in Dharavi and M Ward, which is the battleground in Mumbai. And Mumbai is probably the battleground in the country, one of the key battlegrounds in the country. Nearly a quarter of the deaths we had nationally have been in Mumbai. And we've had organizations like Antarang, Apnalay, Sneha often collaborate together, Praja, and they've all kind of done a great job working together. And we've had the Gates Foundation and us work together with them. BMC has been a partner, key partner, coordinating these entire efforts. And so we've really realized that these partnerships are invaluable. You need BMC to have coordinated everything, and you needed all the organizations on the ground to have actually delivered. And by the way, the interesting thing is when all the supply chains of food went down, the supply chains which went up were actually our partner organizations in rural Maharashtra. We had organizations like Yuva, Manav Lok, and others who actually set up food supply chains to send food from those areas into the slums of Mumbai. So collaborations both with governments and within NGOs was a very, 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 very big learning that we've had in this crisis.
Thanks, Amit. I've been looking at the questions that have come in, and I've tried to answer some of them in the chat box itself. But Anshu, if I can ask you, where or how are we collectively as civil society going to build the sort of policy voice, the sort of resilience at the sector level that clearly seems to be the need of the hour? Do you have any thoughts on that?
So Ingrid, you know, the sector is always relevant. Fine. I think it's a different thing that people didn't give value to it. And anytime you have to abuse someone, you have to say corrupt, all kind of bullshit words, you know, you talk about NGOs. I think people forgot that this sector has the best possible brain of the country, right? It's not just run by anyone who does not get job anywhere, the common perception of the market, right? It has, and this particular disaster has actually shown the efficiency of the sector, the resource mobilization, the risk-taking capacities. So to be honest, in my opinion now, I don't know whether the governments will learn from the NGOs or not, but the corporate sector certainly must start learning from the NGOs. And how do you really operate, and how do you really take risk, and you know, how do you get so emotional and so practical also, and perform. So I think it's important that the corporate sector also understands it. Plus, the way we have seen continuous attack on this sector in the last many years and decades, fine, because it's always considered like a faltu sector. And the moment you say it should happen, you are actually considered an activist. I mean, I don't know. So this is a time when all of us really need to understand our collective value, very important part, because we should stop singing song about our own institution, but we should talk more about the sector per se, because this is the only sector which has been attacked again and again, but we never responded as a sector. And if nothing else, this sector and the larger public on this earth must understand the value of the social development sector, right? Because the fact remains that if, as Amit also mentioned, if people are not left hungry on the roads, if people didn't starve, the biggest work actually is done by the voluntary sector to take care of the food at the cost of their own safety, their own resources, their own institutions. People have sold whatever they had. People have put in every single penny in their institution to make sure that people are not hungry. So now the sector also has to claim its space. It has to assert that we exist, and we exist in a big way, and we are the problem solvers. We do fill very critical gaps at the time of crisis. So my only point is that we need to assert our space. We need to claim our space. And it's not a right-based activity. It is a simple fact that we need to showcase that this is how the sector has been operating. And the fact remains, again, going back to Amit's statement, that nothing is new. Not that migration was not happening, not that people were not working, not that the so-called financially poor people didn't exist. It's a complete failure of the society. I think from my first webinar, I've been saying this, that if these millions of people didn't trust any of the government, any of the employer, any of the contractor, any of the RWA, it is people like us who have lost it. And social sector, the last point is that, you know, many of us, like I know that what we have been doing for the last 2 decades as Gunj and as hundreds of partners with whom we work, very closely, we have been bringing people from minus to zero, right? And that's what we've been doing. Now, this particular disaster has again pushed those people to much deeper minus. That next 10 years, we might just end up spending and bringing them back to zero. How many kids can come back to Kota for study because their parents have already sold their lands when they came here first time? So it's a very complicated situation. I think the sector certainly has to assert, sector has to speak, sector has to say that we are doing a positive work and we are actually filling up huge amount of gaps, you know, and that's an important role in the life of people, especially the people who have again gone back to minus. And then also set the priorities right. I mean, how it's a complete situation of deficit of trust. We have cheated people as society, as people, you know, wearing good clothes. We have cheated people. It's very simple.
Thanks, Anshu. Amit, what are the chances that coming out of this crisis, I mean, I'm asking you to sort of gaze into your crystal ball, if you will. What are the chances that we can actually see business, civil society, government come together to look at these deeper solutions, where we're reimagining, for example, what labor protection looks like, or what you know, a universal basic income might help to achieve, or what public health needs to look like? Or are we again, do you think we're again in a situation where 6 months from now we will have all gone back to business as usual and you know, not fail to capitalize on the opportunity that this crisis presents?
So, Ingrid,
I saved the easy question for you.
I think society consists of lots of individuals, and I don't think you will see like there will be a bell curve of individuals, and unfortunately a very large percentage, I do believe, of people will come out of this reverting back to their old ways. I think unfortunately that will be the reality. But I think because this is a, you know, a black swan event, my own view is that there will be a finite number of non-trivial finite number of people who will come out of this thinking very differently. And therein lies hope. There's so much of wealth in the world, that even if a non-trivial number of exceptionally powerful people come out thinking very differently, you will see a number of issues getting supported in a manner which we have never seen them getting supported before. Will that laundry list look like the list that you talked about? I do not know the answer to that question, because we do know that every person has their own set of things that they care about. And as we are sitting through the crisis, there are different people who are seeing things from different lenses and getting impacted by different things. Some people will be looking at the migrant crisis and, you know, seeing one set of things, and there'll be some people who'll be sitting and thinking about mental health issues, and there'll be some other people who'll be, you know, sitting and seeing, you know, the issue of a slum. But so different people will be getting shaped by different set of things, and they will react. But I do think that there will be a number of people who will react and who will do things very differently. And my hope will be we will unlock both capital and effort. I've actually surprisingly had conversations with some people who surprised me. I've also already had you know, lots of co-donors in a number of the initiatives that we have you know, donated to, who have surprised me again in some cases. So there is definitely hope.
Thanks, Amit. The situation on the border, of course, is not helpful in keeping our attention focused on anything substantial. Pritha, if I can take a second, what role, if any, can these ecosystem organizations, like yours or ours, that have access to both funders as well as civil society, and in many cases to media and government as well, what role can we play in ensuring that people stay focused on these issues and, stay in it for the long haul, so to speak?
Yeah, I think the first and important role, which probably we have done less of, but are beginning to at least start conversations on, is to actually represent the sector at multiple fora. So, for example, we have been deeply engaging, or trying to engage is the word, with Niti Aayog and PM Cares to see if a portion of the funds that, in my mind, has to come back rather than come back to the social sector, given it has sucked out a lot of the CSR and other philanthropic funding to support the cause. So I think coming together and giving a combined rallying call to government, which has now recognized the value of nonprofits and has set up, for example, the civil society and private sector interaction forum, which Amitabh Kant leads, but to actually refocus or purpose them on the funding question, I think is the number one point, definitely, that I think sector builders like us can do more on. I think the second thing is that, as we look at the needs of the sector, how can we all actually ensure we are serving different needs and different segments, right? Because the needs are so large. And as Amit also said, if you borrow the analogy of a bell curve, different NGOs have different needs, whether it's at the service delivery, financial management, sometimes on knowledge research, or sometimes just hand-holding to do their core implementation. And different sector builders have varying strengths. So I think actually being more coordinated as a group to refer requests that come in that maybe somebody else can cater to better in all directions, I think is the second thing that we can do more sharply, and probably have done it, very informally in the past, but can there be a more formal network? And I think the third and important thing in my mind is, given the collaborations are growing, is there any way that, there can be a backbone role that several of us sector builders can play in enabling these coordinations? Because right now, of course, a lot of us are doing this under crisis mode and we're all collaborating. But, once we start looking at recovery, I'm sure Anshu, Renuka, even foundations like Amit have such busy day jobs. They have absolutely no or very limited time to engage in being that glue that brings everything together. So what can sector builders do to actually provide that support in ways that are impactful and can be borne by the wider network? So I would put those three at top of my mind: more work with government to get funding back into the sector, enabling collaborations, and second, coordination across the bunch of us that are sector builders, so that we can be of better service to the community.
Thank you. Renuka, I'll come to you with one last question. If there's one thing that funders can do to improve the situation of the woman you spoke about, that woman who sort of, in a sense, typifies what the Gandhi's talisman, what is the one thing that could make a difference to her life?
One thing that definitely can make a difference to her life is try to be in her shoes and not just quantify your donation in terms of outputs and outcomes, but be with her, walk with her, and hold her hand and say that, yes, we are with you and we believe in you. Stop policing and believe in the cause that you are associated with. That's why I firmly believe that you can rebuild hope, provided you have trust in each other. And that's what Anshu was also mentioning. We have broken trust of people, because it's primarily because of that the people are facing this misery.
Yes.
Unfortunately, as a sector, we have lost face, not because we were not brilliant, but because people projected us like that. So it is time that people start recognizing, and especially during this difficult time, what NGOs have been able to do or NPOs have been able to do is remarkable. So we together need to have a big round of applause for all the work that NPOs have done.
Yeah, so maybe we need another round of Tali Bajai, this time for non-profit.
Not for us. Nothing of that sort. But we never pat each other's back to say, yes, you have done very well. And we need that, especially during this time when everything is so gloomy and dark. So sustaining hope is what you need. No, for that woman, for the grassroots workers, for everybody.
So what I'm hearing overall, and I'm not going to try and summarize everything that everyone has spoken about today, but what I'm hearing is, one, that we need a much stronger ecosystem for the nonprofit sector, whether that is people that will allow us to amplify our stories, people that will allow us to have access to the policy forums that we need to be part of, that people that will look at perhaps setting up resilience funding. So we need a whole series of building blocks in this ecosystem to get invested in. And we're going to have to do this while at the same time struggling to survive. So
Yeah.
that's the real question, that's the real dilemma in a sense in front of the nonprofit sector. That even as we're facing these existential threats, we're going to have to somewhere find the time and bandwidth to come together to build these ecosystem pieces. The second thing I'm hearing is that we need a much better narrative, or our capacity to tell our stories needs to be significantly better than it has ever been. We have an opportunity right now where people are looking at the nonprofit sector quite differently from the way they looked at it 3 months ago, and to sort of build on that opportunity to tell more stories directly from the grassroots to the public at large, so we don't lose this momentum that we've gathered, I think maybe another key priority. Certainly, a third priority I'm hearing is the need to look at norms within philanthropy, so that philanthropic norms, which over the last 20, 30 years have tended to go towards the short term, the easy to measure, the ROI kind of norms, really need to be expanded to look at building stronger relationships with communities, building trust between donors and grantees, and then funding based on those trust-based relationships rather than in this transactional way that has become popular in the last few years, particularly, I think, thanks to the CSR model. I'm going to thank all of you for your time. I know it's getting late. We've already taken more time than we expected to, but thanks to all of you for your questions in particular. We will get back to as many of you as we can. And many of the questions that you've asked will in fact become part of our follow-up study that we're proposing, that will be on a much larger scale than just these 52 organizations that we were able to reach out to for this. And will certainly inform everything that we're doing within our networks, whether it's with funders or with intermediaries or with nonprofits. We look forward to collaborating more closely with many of you. And we're counting on your leadership to make this happen. Thank you all.
Thank you so much.
Bye-bye.
Bye.